forget the day we met. Your eyes so blue, me piercing through. I can't forget the day we met. Your smile so bright, it made me swoon. Our love is like a summer's day, hot and endless in a magic way. Whenever I see you, all I can think is my summer.
WHO recommends that all women should be supported to breastfeed. If COVID-19 is suspected or confirmed, these hygiene measures can help protect the baby. Washing your hands before breastfeeding, coughing or sneezing into a tissue and disposing of it immediately. Cleaning and disinfecting surfaces you have touched. Wearing a mask where possible. If a mask is not available, WHO still recommends breastfeeding, as benefits outweigh the potential risk of transmitting the virus.
It is my advocacy, awareness of breastfeeding and calf feeding during pandemic should be encouraged. Mothers and infants should be cared for together and skin-to-skin contact ensured throughout the COVID-19 pandemic. If the mothers are too ill to be breastfed, they should still be supported to express their milk, and the infant should be fed by a healthy individual. Guidelines based on this current evidence we produce and can be distributed to a healthcare facilities where accessible information is needed. In the same month last year, pregnant women around the globe halted activities in response to the growing population which acquired coronavirus. Many pregnant women have experiences of a great fear to be admitted in the facility because of the pandemic. A year passed by, still the protocols and an arising new virulent virus came along in our society. Mothers and babies were at risk in this season of pandemic. In fact, this pandemic has reflected a poor healthcare delivery system because of shortages of healthcare providers, and some were dying and fighting in this virus. Whereas mothers in neonatal intensive care unit are prevented from breastfeeding in the facility due to less contact to the infant and avoiding spreading of coronavirus. Why is breastfeeding important? It contributes to growth, cognitive, and psychosocial development, providing a healthier population capable of a greater achievement and a longer life. What are the benefits of breastfeeding? For the baby, ideal and complete feeding, contains all the nutrients, protects baby against illnesses as ear and respiratory infections, provides antibody against diseases, infections, allergies, and diarrhea, creates a special bond between the mother and the baby, supports optimal brain development, and enhances intelligence and promotes better teeth. For the mother, no preparation, no cost, always readily available, helps lose pregnancy weight gain faster, helps uterus return to its normal size, decrease incidence of breast cancer, ovarian cancer, and osteoporosis, reduces the cost for medication for sick baby because of breastfeeding infants do not get sick easily, promotes natural child spacing since breastfeeding delays ovulation and decreased risk of postpartum hemorrhage. Calf feeding is an alternative feeding method that is used to provide a supplement to a breastfed baby. Mother and child can be together and the baby is able to latch on well. An alternative feeding method should not be used when possible. It is always best to breastfeed. However, calf feeding may be a good choice when a baby low birth weight, unable to latch on the breast of the mother, separated mother and child for a long period of time because of situations like COVID-19 mother and any severe illnesses, refuses to take the breast and take the cup bottle. Calf feeding is not a new technique. It has been used around the world for centuries, and it is considered a safe way to feed young infants even when they are premature. By choosing to use a cup to supplement the baby instead of a bottle, may be able to prevent the child from developing a preference for the bottle or artificial nipples. This may make it easier to transition for breastfeeding once the baby is able to latch on the mother's breast. Every year, more than 20 million infants are born weighing less than 2.5 kilograms, over 96% of them in developing countries. These low birth weight infants are at risk or increased risk of early growth retardation, infectious diseases, developmental delay, and death during infancy and childhood. The WHO, or the World Health Organization, aims at global nutrition targets 2025 and diet-related global targets for 2025 endorsed by the World Health Assembly in 2021 and 2013 respectively, provide a concrete goals against which progress toward ending malnutrition in all its form can be measured. Efforts to reach the global targets also contribute toward achieving sustainable development goals. Although most of the infections occurs in adults older than 60 years, some pregnant women have also been infected, causing concern for the management of the perinatal period. A few studies have explored the infections of neonatals with SARS-CoV-2 and none show breastfeeding and calf feeding as a method of the transmission of the virus. Various research studies reporting primary data have been published on SARS-CoV-2 transmission in the perinatal period. According to our Department of Health, Sir Duque added that mothers with suspected and/or COVID-19 should continue breastfeeding, following proper wearing of masks and frequent proper hand washing before and after contact with the child. Among the few cases of COVID-19 infection in the children, most have experienced only mild or asymptomatic illness, and this must be supported with the immunological benefits of breastfeeding in infants and young children.
Child research has shown that breastfed babies have higher levels of beneficial gut bacteria and healthier growth patterns than babies who are not breastfed. That breastfed babies have a lower rate of wheezing, one of the most common reasons infants are hospitalized or receive medical care, and that they have a lower risk of developing asthma as they get older. The researchers found that these health benefits were greater when babies were fed only breast milk and for a longer period of time. But they also found that partial breastfeeding or breastfeeding for a short time is good for babies too. In other words, they found that even a little bit of breastfeeding is beneficial. Child researchers have discovered that how a baby is breastfed matters too, meaning there's a difference between feeding directly from the breast and feeding pumped breast milk from a bottle. Among the thousands of babies in the child cohort study, the risk of asthma was lowest among those who received only breast milk directly from the breast in early life.
Okay, so I would like to start our lecture about breastfeeding. Kaya mga kababayan, be proud we have a breast. Meron ba? Wala pala. So be proud, meron kayo. So we have here breastfeeding and kangaroo care is very important. Why? So dito natin malalaman sa SARMED. Kasi dito sa SARMED, we are encouraging mother to have breast milk, kailangan talaga breast milk. Kaya sa NICU, kapag kayo dito, nagpa-admit kayo, one of the nurse, yung mga babae, at mga magaganda at well-accommodating sila. So sabi, breastfeed is very important. So, gina-discourage namin yung mga formula milk, no? Kasi bakit? So, we will learn it. Hindi natin siya kailangan yung breast milk, pure breast milk, lalo na si ma'am, di ba ma'am? Coming soon. So, nandito lang kayo, welcome kayo, nakatok lang kayo, punta lang kayo sa SARMED, sa NICU, you are welcome, and we're going to explain to you kung ano yung breast milk and mother kangaroo care. So, we are practicing here. So, yan here. So, why is breastfeed ay kailangan importante sa bata? Sa iyong palagay po, ma'am, it is your first time po, ma'am, pagbubuntis? Sa ikaw, si alam na alam. Yung first mo ba ng baby, ma'am, naka-breastfeed po ba yun? Oo, sige. So, alamin natin, bakit kailangan talaga is breastfeed is very important. So, why breastfeed is your baby? Because breastfeed is very important. So, it will contribute to growth and cognitive of your child, and also it will assist psychosocial development. You provide a healthier of your baby, and then it will help also to capable of greater achievement and a longer life. So, ibig sabihin, longer life. At hindi pa, importante din ang breastfeed. Bakit? Kasi nagiging matatalino ang bata. Tignan mo, matatalino ako. Matalino sila kayong lahat, di ba?
Kaya mga mommies, ano pa yung nilay ninyo? Breastfeeding is good for your babies. Kaya tara na,